Hello, my name is Macy Limberhand. I'm a student nurse, and today I'm going to be demonstrating how to set up an IV Piggy Back. The first thing I'm going to do is list off my 6 rights of medication administration, which is right patient, right medication, right route, right dose, right time, and right documentation. Next, I'm going to perform hand hygiene, whether that be washing my hands or putting hand sanitizer on. Okay, the next thing I'm going to do is I'm going to obtain my order from a physician. So today I need to give chloroform 560 milligrams IV Piggy Back every 8 hours. This one we're going to infuse over 45 minutes, and it's going to be split up into 4 doses. So my order says that I need to add, if I did the math correctly, 1.1 cc of the reconstituted chloroform to a 50 milliliter bag of normal saline solution. So the next thing I'm going to do is I'm going to go and gather all my supplies. So I'm going to get a 50 ml bag of normal saline. And when I grab this, I'm going to look at the packaging, make sure it's not open, the expiration date, which it's not expired, so we're good there. And then I'm going to look for any particulates in this bag, and there are not any. So then I know this is an IV Piggy Back, so I'm going to get a secondary medication tubing set. We have this one, and I'm going to note that my drop factor is 10 drops per milliliter approximately. And then I'm going to get my chloroform, which is reconstituted here, a 3 ml syringe, and then just some alcohol swabs and some gloves. Okay, so once I have my drop factor set for my tubing, I can go ahead and calculate my rate of infusion. So I have a drop factor of 10 drops per milliliter, and I need to administer 67 mils per hour. So that comes out to be 11 drops per minute. There it is on my MAR, and so when I'm looking at my MAR, I'm going to confirm that this is my patient. This is her medical record number, that it's the correct date and time to be administered, and I'm going to look at any of her allergies. Okay, now the other thing I'm going to think about before administering this to my patient is this a correct dose or an appropriate dose for this patient, depending on her age and her weight. After doing some research, I found out that this dose is a little low, but she does just have, I think, a mild infection, so it'd kind of be right in with that mild range. So it is appropriate. Okay, so now I'm going to draw up the chloroform and add it to my IV bag. I cannot get this packaging done. Okay. So I'm just going to put some gloves on, and this is just kind of a safety measure, just to make sure that everything is good and clean. Okay, so I'm just going to wipe off this part of my IV bag, let it dry, and then also of my medication. I will let both of those dry. Pretend like that wasn't there. Okay, and checking my medication one more time, I have to drop 1 cc because there is 500 milliliters or milligrams per milliliter in this vial. So if I did my calculations correctly, I should have to drop 1.1 milliliter to get 560 milligrams of the ordered chloroform. Okay, so I'm going to draw up 1.1 milliliter. Hope you can see that, of air, and I'm going to inject it in. Okay, now I'm just trying to get the air bubbles out. Okay. So now I have 1.1 milliliters of the chloroform. Now I'm going to put it into this IV bag. Okay. And I will throw this into the sharps container, and then I'm just gonna kind of mix this around, just making sure it's all mixed up and that everything looks normal with it. Yeah. Okay, now that I have my IV bag ready, I will go into the patient's room, and I'm just going to explain that I'm giving her chloroform, which is an antibiotic as prescribed by her doctor. I will check to see, I'll ask for her name and date of birth. IV needed 2/2/98. Okay, that is the correct patient. And I'd scan her wristband, depending on hospital protocol. So now we're just gonna get her tubing ready here. And we have an IV Piggy Back. I think this goes around here. Maybe. Well, I'll just have that set up. Okay. And now I'm just going to spike my bag. I'm going to pull this off. And then without touching the spike, I'm going to go ahead and spike this bag. Okay. Oh, and before I spike this bag, I would make sure that my clamp is set so that we don't make a huge mess. Okay. Then I will go ahead and hang this with my makeshift IV pole. So when I hang my IV Piggy Back, I would make sure to hang it higher because whatever is higher is the one that's going to run. So then after I hang it, the clamp is set, I'm going to squeeze this drip chamber. There we go. Okay, and then I'm going to get it going. And actually, I want some more fluid. Okay, and just letting it go all the way through the tubing. Making sure to get all the air bubbles out. Okay, I might clamp it down again. Okay, so I'm going to hang it above my primary, and then I have my patient here, her IV. See if I can show you better. Okay, so this is her IV, and I would have inspected this and made sure that there were no signs of phlebitis or irritation. So then I'm going to come to this little port here, and I'm going to wipe it off with an alcohol swab. And then I'm going to take the cap off of my Piggy Back. And connect it to my normal saline line. Okay, and then when I hang the Piggy Back, I would put a medication card on it, a red one, and I would put the amount of medication that I added to the amount in the bag, the time that it started, which was 1500, the expected time for it to be done, which would be 1545, patient name, date, or my initials, date. Yeah. Okay, and then I'm going to go ahead and set my rate. So I have calculated that I need 11 drops per minute. So the way I'm going to do this is this would be hung, but it's not. So I'm going to look at my watch, and I'm going to count out 11 drops per minute by rolling up this. Okay, that's way too fast. Okay, so I'm going to sit here and count for a minute. Okay, so I now have my infusion rate correct. So I'm going to hang this bag, and then I'm going to let it infuse for the full 45 minutes. Okay, so once my antibiotics are done, we're going to pretend like this is gone. I am going to clamp off my roller. And then I'm going to discontinue this from the main IV, which is just my normal saline. And then I'm going to discard of it. And I'm going to monitor how the patient did with it. So I'm going to ask her things like, look for any signs of phlebitis or anything like that. And then ask her if she had any discomfort while it was going through. And then I need to reset my primary IV to 28 drops per minute. So I'm going to take my primary IV bag, and I'm going to set it the same way that I did with the antibiotics. So I'm going to set a timer and just count the drops. Okay. And then once I have that set, I will just put the main IV back to the right height. And once again, just educate my patient on looking for signs of phlebitis and checking the IV site. Doesn't need new dressing, anything like that. And it actually looks good. I'm gonna check for warmth, bleeding, stuff like that. And my patient seems to have tolerated it well, so I will wait and just see her when the provider orders something next. Thank you. One thing I did forget to mention is I would document everything that I just performed on my MAR. So, I have this, and I would make note. I would say patient tolerated well. And then sign it. If there was anything that went wrong, I would make a note of that and then sign it.